This is Talk with Audrey. Welcome back. Heart disease remains the leading cause of death for both men and women in the United States. And joining me with information about some non-surgical treatments for coronary and valve disease, Dr. Charles Davidson, the clinical chief of cardiology at Northwestern Medicine's Bloom Cardiovascular Institute. Hi, Dr. Davidson. How you doing?
Good. How are you today?
I'm fine, thank you. So heart disease, there are lots of different types of heart disease. Who is most likely to be impacted by heart disease?
So there's kind of two forms of heart disease that we most concern ourselves with the most commonly, and those are coronary artery disease, which are blocked arteries in the heart, leading to bad blood flow to the heart, which can cause heart attacks or stroke. And then the other form of heart disease is valvular heart disease, which regulates the blood in and out of the heart. And valvular heart disease is generally one that can either be congenital or develop later in life, acquired, but not necessarily modified by risk factors. But the people that are at risk for coronary disease, and that's when we talk about heart attack and stroke, are people that are smokers, have high blood pressure, have diabetes, and have a sedentary lifestyle. So patients that really continue to smoke, if you think about the worst risk factor for heart disease that can be modified by a change in habit immediately, it would be stop smoking. High blood pressure, if you have suspected or high blood pressure, it should be treated aggressively. If you have cholesterol that's elevated or you have a family history of heart disease, those should be treated aggressively as well. Don't accept numbers that we used to traditionally accept of bad cholesterol of 110, 120, 130. That's not acceptable anymore. That's got a form of therapy that we know will prevent heart attack or stroke. Usually that's a statin therapy. And then if you have diabetes, important to have exercise and good diet, and also be on the proper medications to control your diabetes. And all of those, if you move them in your favor, are going to decrease the incidence of heart attack or stroke and need for stents or bypass surgery.
And of course, if you have all three of those, and I'm sure that there are people who have all three of those risk factors, you're really putting yourself again at risk for heart disease. What is it that smoking does to the arteries in our body that creates such major problems?
So smoking really has a multifaceted bad effect on the heart. It can cause plaque to build up in the arteries. It causes the arteries outside of the heart to also narrow, which causes more hypertension. It has a bad effect on the lung as well, so less oxygen transfer within the lung. And all of these, add up to the risk of heart attack or stroke. The other thing that's important to talk about is that vaping has become fairly popular, particularly among the youth. And I think there's a false notion that this actually doesn't have the ill effects of smoking. And at least to our knowledge at this point, it's just as bad as smoking. There's really no protection against the effects on the heart from vaping. So please, the people that are thinking, well, if I convert to vaping, I'll be fine, or if I start with that, I'll be fine. There's really no evidence that that's the case. It's kind of a false sense of security and really probably putting yourself as much risk with that as you would with traditional tobacco use.
So the traditional nicotine and all those chemicals you're still inhaling, and it's going through your lungs and causing problems. Wow. So the heart then pumps blood throughout the rest of the body, which means I guess it's, if you're either pumping good stuff or bad stuff into your system and it's building up. Is that sort of a simplified way of looking at it?
Absolutely right. All of these things are absorbed by the body and into the bloodstream, and the bloodstream then carries this throughout the body. And if there's, evil humors, if you will, circulating throughout the body, they're going to collect in areas that cause narrowing, cause constriction, and impair blood flow, impair oxygen exchange, and then have a long-term effect, and can even have a short-term effect to cause heart attacks acutely.
So if you have, say, all three of those risk factors, you are then putting chemicals into your system that are going to be transferred throughout your body. And in that transfer, if you have high cholesterol, what's added to that cocktail, if you will?
Yeah, so high cholesterol, luckily we have really great treatments, and statin therapies that have been out for a number of years should be routinely used in people with high cholesterol. There's actually now also injectable therapies that are available for people that can't tolerate statins. Some people develop muscle aches from statins, about 5% unable to tolerate them. We now have injectable medications that are very effective. And the other people that, even with statins, we're not getting good cholesterol management, can be treated with these injectable therapies. But bottom line is, have a discussion with your healthcare provider about what's the best treatment for you. Make sure that they're being aggressive in the management of this. I think that was the early lesson we learned when these medications became available. We were still probably underprescribing them as a whole, and when we were dosing them, we were underdosing them. It's been readily apparent that if you have established risk factors and you have high cholesterol, that it has to be treated aggressively. And if it is, you'll really lower the incidence of heart attack, stroke, and the risk of dying. They do have an impact on longevity. It's real.
And the additional risk factor, which is diabetes, how does it make its contribution?
So diabetes also contributes to heart artery narrowing. There's inflammatory components and blood sugar components that we know are related to heart artery narrowing. It's a disease that is often really rampant in the heart, can cause very diffuse narrowing of the heart arteries. And the thing that's a little scary about diabetics is that about a quarter of them will not have symptoms, the typical symptoms of chest discomfort, breathing problems that we expect from patients with heart disease. They are asymptomatic. So in diabetics in particular, the number one cause far and away of death in diabetics is heart disease. It's not diabetes, it's heart disease. So they need aggressive screening and really should be considered for routine stress testing in this population, and make sure that the risk factors are highly controlled, because they're not always going to present. Their first presentation may be a heart attack because they've never experienced symptoms despite pretty severely blocked arteries.
Wow. So guys, if you were out there thinking, okay, I don't have that and I don't have that. Oops, I got that. Now you know of the three risk factors exactly what your risk is.
Right.
So, because, people can talk themselves out of, potentially having a problem, right? And you don't go to the doctor.
There's a lot of denial. There's a lot of denial in heart disease. I mean, even very educated, bright people that know about these diseases, when they develop it, they go, "Well, it's not me this time." But we have this saying that time is muscle, and that if patients develop acute symptoms, they really have to seek treatment early, because if we get that artery opened earlier, the chances of having a lot of damage to the heart muscle is much less. But if they're even getting warning signals, they're exercising now, they don't feel quite as well, or they're doing things and starting getting some chest discomfort, they're just not, don't ignore those. Get it checked out, because often you're going to save yourself a much larger problem if we can get to it earlier. And you may not need any stent or anything. You may just need some medications or just some alteration in your lifestyle to avoid a significant problem later.
So is the first symptom normally a heart attack?
Not usually starting with a heart attack. Most people will come in with some warning signals of chest discomfort and shortness of breath. As I said, diabetics often don't have that warning signal. And the other thing that's interesting is that women don't typically have the same symptoms that men do. So men, you think about the traditional chest tightness, heaviness, pressure. Women will often come in with atypical presentations, and that might be back pain, jaw pain, arm pain, which is why women are often diagnosed later in the course of the disease or later into a heart attack, which is why their outcomes are sometimes a little bit worse. So important to not ignore even atypical symptoms in women. And if your physician's not giving you the answers you want and you want to have further, seek a second opinion. But it's important for both the women and the provider to understand that there's not that typical pattern always present in women as it is in men.
So is it possible, Dr. Davidson, to improve your risk factor, improve your condition with diet and exercise after you speak with your doctor, of course?
That should absolutely be a part of anybody's regimen. Whether you can do all of the risk factor modification with diet and exercise will depend on what you've been diagnosed with. But that is not going to hurt regardless of what the diagnosis is, once you've been cleared by your physician for that. We can talk about the other risk factors that we mentioned already that need modification, but Added to that, a sedentary lifestyle is a risk factor. Maybe not as important as some of the other ones, but it is important. And so that's why we recommend, and people have been diagnosed, to get out there, exercise. Do 30 to 40 minutes, 4 to 6 times a week. And I always tell patients, look, you can walk, you can run, you can swim, bike, row, whatever, elliptical, whatever is interest to you, and you can mix it up. But just try to put aside 30 to 40 minutes, 4 to 5 times a week, and you can impact your risk of having a heart problem.
Wow. And it's something that sounds relatively easy to do. But as you know, people put it off. So guys, if you have a problem, there are some non-surgical options for repair or replacement of your heart valve, which we hope you don't ever need. But if you do, Dr. Davidson has some information about that. So what are these non-surgical options, Doctor?
So traditionally, when people developed blocked heart valves, particularly the aortic valve, which we call aortic stenosis, or a leaking heart valve like a mitral valve, which connects the top and bottom of the heart, the only way to treat that was, once it got to a severe stage, was open heart surgery. We've now transformed that so that at our hospital at Northwestern, 75% of patients with aortic stenosis get treated with a catheter, so a tube from the leg, and a replacement of a new valve over the old valve. So that's called a transcatheter aortic valve replacement. We do that without general anesthesia. Patients are generally home within a day or two afterwards. Risks are low, below 1% for death, 1% for stroke, so very low risk. And we know that it extends lives and improves the quality of life. And compared to surgery, it's actually been shown to be a benefit compared to surgery for both of those outcomes of death and stroke. What's been exciting is that now that we've done so many of those and the technology has gotten good, is we're now moving into other valve areas, mitral and tricuspid. So those are in the early stages. We have trials going on, and we have some commercially available devices, but there are options available. So I think for patients that are been told they have a heart valve problem, make sure you're exploring all options. Sometimes your medical community isn't even aware of all the options because the field is moving so quickly. Get a second opinion, take a look, see if surgery is the right thing, medicine's the right thing, or if a catheter-based option is. And increasingly, the catheter non-surgical options are becoming mainstay and helpful for patients to get a quicker recovery.
Well, it's amazing when you think about, so it went from actually, cutting you open heart surgery, to a catheter. Hello. That's
right. Just doing it from a leg artery. Patient, you come out after the procedure, and the family will say, that was awful quick because it'll be less than an hour. And I say, well, look, if you want me to spend more time in there, I will, but we're all done, And it really has changed what, could have been a half-day open heart procedure down to a less than an hour procedure with the aortic, and now we're looking to do the same thing with other valve therapies to extend lives. And the other thing is that some people were just too high risk for surgery. That was another group that, they're 80 years old, 90 years old. I had a woman, she was 101, she's now 110, and we did her valve from the leg. So, these are people that surgery wasn't even an option. So now we're able to extend their lives as well.
Amazing. Absolutely amazing. So where can we go for some more information, Doctor?
So go to heart.nm, northwesternmedicine.org. There's patient stories, education, treatments, diagnoses, and what new technologies might be available for your condition. And I'll be happy to, I think you'd find it an informative website for your audience.
Wonderful. Again, guys, Informs Empowered. My guest has been Dr. Charles Davidson. We've been talking about non-surgical treatments for coronary and valve disease. Check it out.